Okay, are we ready? Okay.
Good morning. Thank you all so much for joining us for our new webinar series to help connect you to resources locally and statewide. My name is Walisha Wilson. I'm the founder of NewLife-Second Outreach Incorporated, and we are a resource sharing hub for Georgians who are impacted by an arrest, conviction, or incarceration. And this is our way. We normally share resources on our social medias as well as through email, but we no longer share them through emails unless you are an individual who's impacted by the registry, as they often cannot access social medias. But this is our way to be able to, instead of just sharing stuff, to be able to put faces to those agencies who's doing great work throughout the state to support individuals impacted by an arrest or conviction. And even though that is who we aim to and our services are targeted for, these series are open to anybody in need, as we have resource providers who will help with domestic violence assistance. Coming up in November, we're going to be doing stuff, folks will be helping with holiday assistance, whether that's groceries, rental assistance, legal assistance. And so thank you all so much for joining us. And I'll drop our information in the chat so that you can register for our upcoming webinars. And right now we will introduce you to Ms. Antionette Jarrells, who will tell you more about the Georgia Mental Health Consumer Network's services and programs, including, I think you all also host training programs for individuals who are in recovery, who want to be peer support specialists, right? And your house
Right.
programs. So I'm gonna turn it over to you. So if you can just let everybody know about those programs.
So I work for Georgia Mental Health Consumer Network, but I'm also the director at the Decatur Peer Support and Wellness Center. And so
Okay.
this is one of the programs that we do offer to support our peers in. We also have other trainings that we do, CPS training. We have the the Respect Institute. We do WHAM, which is Whole Health Action Management. We do WRAP trainings, which is the Wellness Recovery Action Plan. But personally, I work at the Decatur Peer Support and Wellness Center. And I can give you, if you don't mind me sharing a little bit about what I do and what we do here.
Yes, ma'am. Absolutely.
Okay, so at the Decatur Peer Support and Wellness Center, we assist and support peers 3 different ways. We have a warm line, and what that is, our warm line is 24 hours a day, 7 days a week, where peers call in. If it's their first time caller, they register with us, where we just get some of their personal information, name, date of birth, phone number, and we register them. Each peer is allowed to call in twice a day, an AM call and a PM call. Each call lasts for 20 minutes. So we have a lot of our peers who are homebound, can't get out, older peers who don't have transportation. This is a big support for them. During these calls, we support them by listening. 90% of what we do is listening. We don't give advice. We don't tell them what to do. We meet them right where they're at on their phone call, and we support them right there. The second thing that we do is we have wellness activities daily. Each activity lasts for an hour. The peers that come in here, they sign, of course, participation forms stating that, everybody comes in willingly. You have to be at least 18 years of age to come to the Wellness Center. We have activities that start at 11 o'clock. We open at 10. We're open from 10 to 6 every day, 7 days a week. Saturdays and Sundays are days where peers come in, they watch football, they just socialize with one another, they get on the computers, which is considered an activity, but those are free days. Monday through Friday is a day where they come in and they get support from us through activities. That could be trauma-informed peer support. We do whole health action management. We do de-escalation. We do a WRAP. We do several different activities throughout the day, starting from 11, that usually goes up until we get ready to close. That's one of the other ways we support our peers. We also support our peers with what we have called the Respite Center. The Respite is where a peer can come in and they can stay 7 days and 7 nights. With that, they come in, we support them, we take them grocery shopping. They get $70 allotted to them, where they get to purchase the foods they like to eat, as well as the foods that we have here in the house. They have to stay consecutive days. They don't have to stay the full 7 days. So say a peer checks in on a Wednesday and decides they want to leave on Monday. That's fine. But if a peer does not meet the requirements as far as checking in, their curfew starts at 12 midnight to 5 a.m. in the morning. If they leave and don't come back, they forfeited their bed. But that is another resource that we have to support our peers. And we're non-traditional. We come because what we do is to prevent peers from going hospitalization. You know, most peers, like I said, with the warm line, if they feel like they're calling, and most of the time, if you call, you know, it's you don't want to talk about certain things because it's subject you to be getting 1013. We don't do that. We listen to them. We hear them. We support them with their own, because I'm a firm believer that everybody has the right to make their own decisions, and you know more and more about you than I know more about you. I know more about me than you know about me. So of course I can make decisions for myself. We respect that, and we support them on the warm line with that, as well as we do when they come into the house. We do have other outside activities that we do. We do like we take our peers bowling. We may go to a wellness walk to Stone Mountain. That's some of the other things that we've done. We also celebrate every holiday. So we do events like we have, I think we have Halloween coming up. We'll have a Halloween party where we feed our peers, we dress up. It's considered a free day, and we play games. We just enjoy our peers and they enjoy us. During the holidays, we also feed Thanksgiving, Christmas. We have a full meal prepared for each holiday. We support our peers on birthday months. We have a celebration every month for birthdays. And we do one-on-ones, because sometimes you have a peer who just wants to talk. Like, you know, I want to be supported, but I don't want to do it in an activity. I don't want to do it in the arena with everybody else. I want to do a one-on-one. We support them there as well. But those are the primary things that we do to support our peers here at the Decatur Peer Support and Wellness Center. And as I shared, you know, the first thing that happens is everybody comes in. If you're a first time being here, you would do what we call a model introduction. We would take you through the house. We would show you where, like I said, we have 3 rooms that we utilize for respite guests. We would show you what that looked like. We would show you, we have an art room downstairs. We do art activities. We have a music room. We do musical activities. That's one of the activities that we do. And then we would show them around. We would get them signed up. That means that they can come anytime and participate in anything once they have registered with us. That's whether it's on the warm line or whether it's in person. So that's how they get connected to us. And then, like I said, being 18 and over is really all that is required. Once you sign up, of course, you would need to have an ID with you, Georgia ID, whether it be a driver's license or just an ID. We would have to have that to get you signed up at. But those are some of the things that we offer here from Georgia Mental Health Consumer Network at the Decatur Peer Support and Wellness Center.
Okay. So can you tell us a little bit about the eligibility, what the criteria is? They must have a mental illness, or they must have be in recovery. I know you said
So
they have to be in 18, and then what areas do y'all serve? I know you have Decatur, and I dropped in the chat about the other counties like White County and Colquitt County.
yes,
So
ma'am.
y'all don't serve Fulton or any other places outside of those areas. So just
No,
what
ma'am. Well,
areas y'all serve?
we have one in Cleveland, Georgia, of course, here Decatur, Calquita, Moultrie, and then we have Augusta.
Okay.
Those are the 5 centers that are available. And then, as I was saying, outside of being mental health, as long as you are able to say that you experience mental health, far as whether it's substance abuse or mental health, because we recover from both.
Okay.
So you have to be willing to self-identify.
Okay.
Yes, ma'am. You
Okay.
have to self-identify. And we have had peers that say, I don't self-identify, because they don't understand what we're asking. So we always make sure that we break that down. To self-identify means I have challenges with my mental health.
Yeah,
That
to
doesn't
acknowledge that
necessarily,
to take that, to own that, and acknowledge that you have that and you
yes.
need help with it. Okay.
Yes, exactly. We don't ask, you know, your diagnosis. We don't ask what medication you're on. That's none of our business. That's not what we're here for. We're here to support you right there. Whether you're substance abuse or not, it doesn't matter what you use. We could care less. We are here to support you with the resources that we offer.
Okay, so for anybody that may have asked, I know we did get one question from someone who was not able to attend. Their question, they had two questions. Do they take people up with a criminal record? And I was like, of course, that's why they're on our
Yes,
call.
definitely.
We don't host any events that are not open to people with a criminal record. So it's good to know that. But then I think the other question also was, do you all work with people who are currently incarcerated or they have to be already out?
So to be able to receive services now, like we've had people who have free phone calls that call us who are incarcerated.
Okay.
And they just wanted some support of where they're at. We can't accept calls where we have to pay. We cannot do that. But in order to get the services to really fully utilize what we offer, you have to be able to either call us or come to the center. So being incarcerated, once released, we can better service you, but it is hard to service someone who is already incarcerated. Yes, ma'am.
So if someone was incarcerated, but they needed to be released and needed to get out, are they able to actually call you all, do this assessment over the phone so that they're able to basically get approval, I guess, and say, this is where I'm going. This is where I'll be going post-release. I'll be going here. Is that something you all do or no?
That's a good question because I've had that before. So what we do is we want to make sure, because our staff, and it's not, we have security, but our staff is a lot of women. We want to make sure that the person is a good fit for us, especially if you're going to be living here for 7 days, and that we're a good fit for you. So we prefer to see the person in person. It's kind of like we build a relationship with them within that time that they're here to get a good feel, to see like, hey, this is a good person for us. And no, this is not a good person for us. I will say this, that sex offenders are not allowed. I've had a lot of people ask me, well, hey, I'm a sex offender, can I come? And sorry to say that we don't accept sex offenders. Simply because we have different people who stay here. We have women who come with their child. Women with children are accepted here. So we have to kind of be careful with that. But to be able to do it from incarceration, no, ma'am, we would need you to need to see you face to face. Not saying that you couldn't receive our services. It's just that that's something we need to see face to face, because of course we have to get ID. We got to get all that information. All that has to be accepted before we have to have all that before we can accept you into the program.
Okay. And I appreciate you saying that, but I did want to kind of really just let because we here at New Life and a lot of other places also are really, really cognizant of how we label folks. And I know this is y'all's policy, and I know this is something, and it's just an antiquated term, and a lot of us are just used to using it, but we try to really refrain from calling folks offenders, prisoners, and inmates, because we want to really focus on using humanizing language, and also to make knowledge that not just for y'all, but people who are going to be watching this, to let folks know that because someone has been charged or convicted with a sex offense does not necessarily mean that they have an affinity to mess with children. And then also everybody who has been convicted may not actually be innocent. So I just wanted to just put that disclaimer out there. And I really wish more programs would be open to folks on the registry who are forced to register, because there are a lot of women on the registry. There are about 27,000 folks in the state of Georgia on the registry. About a third of them are women. And oftentimes, most of the folks on the registry have not even molested or tried to attempt a child. In the state of Georgia, if I'm not mistaken, you can literally be placed on the registry for peeing in the wrong place, for having sex in a public place.
Yes, ma'am.
And we even have a husband and a wife who've been placed on the registry because the child stated to her teacher that mommy and daddy was doing it too loud. So these are things that we want folks to be aware of. And yes, and it's very important. But I just want to kind of put that out there because I think a lot of folks do tend to lead with that. And I think that will kind of help how folks see folks on the registry. But I did hear you say that it's a 7-day program. So that's not very long term. So it's basically in a way to kind of sort of like a detox, to kind of get you somewhere, get situated. Do y'all help with long-term placement after that, or maybe assistance?
Yes, ma'am. And so it's a 7-day stay. When I say a 7-day stay, that's where peers can come in and work on what's going on with them, whether it be, hey, where I'm living at right now is too stressful and I just need to get away.
Okay.
Or, hey, I need to come in. We do support unhoused, because where we are, there's a lot of unhoused. And so when
Yes.
we have people who will come in, will say, hey, I'm unhoused, I'm trying to get some support with getting housing. When peers come in and we do a respite check-in with them, they have goals that they're trying to achieve while they're here, or basically things that they want to do while they're here. Once a person checks in, the next day when we see them, when they come down, like I said, they get to, everybody here is self-directed. So that means they have to be able to do for themselves. They come down, they fix their breakfast or do whatever. That's when we begin to contact, like, hey, so I have your paper here. It says that you're looking for housing. So we try to connect them with the PATH team, or any of the other resources that are out there, because the whole point of you being here is so that you can deal with some of the stuff that you've got going on, and we want to support you in that. That's
Okay.
all. That's the main thing that we want to do, is provide support, regardless of what it is. If it's just having a conversation about what your situation is, we want to see how can we support you in that.
Okay.
So yes,
Okay.
ma'am,
And
we do offer, like I said, we have computers, we have help peers get online and get jobs or get links to jobs, learn how to fill out a job application, learn how to do a resume.
okay.
Those little things that, some people say, oh, that's easy. For some people
No,
who
it's
are
not.
unhoused, who don't have this resource in front of them every day, they've never done this.
Yes, and particularly if they don't have an address,
Yes,
a stable address or an
exactly.
ID. So yes, that's
Exactly.
is
Yes, ma'am.
what's easy to some is very hard and
Hard for
challenging for
others.
others.
Exactly.
So
So yes,
definitely,
ma'am.
thank you. So we understand, just to wrap it up, that there are men, you do accept men and women, and they're in the same house,
Yes,
rescue
ma'am.
house.
We do.
And if they sometimes the women might have children, you must be 18. It's in the metro. You have Decatur, Augusta, and those other counties. And we'll make sure we have this information in the actual description of the YouTube page. And
Okay.
those on the call will actually receive the links in email.
Okay.
So I know you mostly focus on that, but for most folks who know about the Georgia Mental Health Consumer Network, I've looked at the website and you all have a lot of programs.
Yes, ma'am, we
And
do.
so y'all have a crisis line?
We don't have a crisis line. We use 988.
Okay.
We use 988 because well, even with what we do, we're all CPS, but they're more trained for higher crises.
Okay.
So we do
Okay.
utilize them.
Okay.
Yes, ma'am.
Thank you so much. I mean, I've heard of Georgia Mental Health Consumer Network before, but never of the program until I contacted you a couple of weeks ago. So this is a really good
They have
program.
and I can share with you, we do have a forensic program where I'm actually a forensic peer mentor, where we go in the prisons.
Yes,
I
that's what I
work in
wanted you
the,
to speak a little bit about that, and then we can open it
yes.
up for Miss Davis if she has any questions.
Okay, I
Um,
worked in the prison for 6 years. That's a great program. Supervisor is Angela Adgers. Where we go in and we work with peers before they get ready to be released. Now they can start their housing before they're released. There are things like I worked with peers on getting their Social Security started back before they were released. Worked on looking at getting jobs set up as they got closer to that release date. That is,
okay.
we also are at the daily reporting centers
Okay,
as
that's the Ready
forensics.
for Reentry program, right?
Yes, ma'am. That well,
Okay.
that's yes, ma'am. So we're there as well. That's another program I've worked as being with the network, going into the DTRs. I mean, I'm sorry, the daily reporting centers, and working with those, who were trying, like I'm on probation. This is what I'm having to do. But just getting released from prison and learning how to reestablish themselves back into the community. Because imagine, if you've been locked up 15, 20 years and you get out and you're on probation, it's like, how do I do this? How do I walk this journey? And so we use our lived experience. We use our lived experience to support peers with reestablishing their lives back into the community. And it's a
Okay.
beautiful thing because we can follow them up to a year and a half.
Okay.
The peer mentor, supporting them even when they graduate the program. We still follow them out into the community. A lot of them don't know how to buy groceries, don't know how to do this,
Hmm.
transportation. Where do I go to get my ID? We assist with getting their IDs, helping them to get their social security cards back. A lot of that as a forensic. Yes, ma'am.
So is that a virtual training program? Is that something, the certification program is in person or is it
That's
virtual?
in person, and I think they're doing it virtual as well now. Yeah.
Okay.
Yes,
Okay.
ma'am.
Well, thank you so very much. And I know have heard people, a lot of folks, I have several friends, Logie and Tabitha, a
Yeah.
lot of folks are actual forensic peer mentors. And so you also have to self-identify if you want to be a forensic peer
ma'am.
mentor
You
as
definitely
either
have to
having a
assess.
mental illness or in being in recovery, right?
Yes, ma'am.
Which makes sense
Yeah,
because who best to mentor you than somebody who's been there and experienced it themselves?
exactly. Exactly. And
Yeah.
most forensics are duly diagnosed. That means
Okay.
yeah,
Okay.
majority of us are duly diagnosed. Most of us are duly diagnosed. But yes,
Okay. All righty. Well, thank you so much.
thank
Right
you.
now,
Thank you
we
so
got so
much.
much done in 30 minutes. I mean, it was great. And I'll definitely make sure we be sharing this information. But at this time, we'll do you have anything else you want to share about any of
No,
that?
ma'am. Thank you for allowing me to share.
Thank you so much. And at this time, we can open it up for Q&A. If anybody on the call has any questions, you can just take yourself off mute. And if you had any other questions that have not been answered or responded.
I just have one question. Good afternoon, ladies. Um, I don't know if she said it or not, but do they train for peer support specialists? That's something that I'm very interested in. I'm a pastor. But I also have a criminal history. I also have a dual diagnosis, but I work with a lot of people. And I work with a lot of homeless people. I counsel and mentor a lot of people that need what you guys offer. That's why I can't.
Uh,
That's why I've been coming on these calls because I really want to know how I can help the people in my community.
Yes, ma'am. So at Georgia Mental Health Consumer Network, they do train for forensic peer mentors. You would just need to go on the website and look for forensic peer mentor train. Look at our trainings, and then we have each one list what we train for, whether it be CPS, forensic peer mentoring, where everything is listed on there. I think with this forensic peer mentor, we're trying to train at least one training every month. So that means you would do the 5-day training. I think they've cut it down now to 3 to 4 days, whether it be online or in person. And then you would actually do a full training. And far as positions that are available, you would see that as well. But Robert Pugh and Angela Adgers, you would look for their names. Those are the two who are working together, I believe, with the forensic peer mentor training. But yes, it is on the network. It is listed under trainings.
All right, thank you so much.
Yes, ma'am.
So I actually just dropped that information in the chat, but I'm looking at their different tabs. So a forensic peer mentor is different than a certified peer specialist.
Yes, ma'am. It is.
Okay. And what are the qualifications for the certified peer specialist? Same thing, must be one or the other.
Yes, ma'am. Same
Okay.
thing.
Okay.
Same thing. Yes, ma'am.
Okay. And I did drop the link for all their trainings there.
Okay. Thank you.
And I will actually ask Ms. Pink, I'm actually going to email you after we get off this call because I appreciate the fact that you are a pastor because that's who wants to help folks in the community. We see so many churches that will sit directly in the hood, directly in high unsheltered areas, directly in crime areas, and will not even welcome folks to jail. A lot of folks have heard my story. When I got out of prison, I would have fell and stood up at church and told everybody, you know, I'm just glad to be in the house of the Lord, just got out of prison. And before I can get to the door at the end of the service was asked not to come back because I had a record. And not one time, not twice, but 3 times. And so I want to just tip my hat off to you, Pastor Davis, because we need folks, particularly in the faith community. If you say you're people of faith, understand that we're all flawed and all of us, just like we ask for redemption and grace, the folks who are in our communities deserve the same.
Yes.
And so I wanted to just say thank you for that. And I'll be connecting with you on a different level with that. But
I'm sorry. Can I
go
share
ahead.
something from Miss Pinky real well? You know, and we have been working in the DRCs for a while, but we do now have forensics in the jails and the prisons. We have a forensic in Hall County Jail. We have a forensic in a lot of these areas here doing work in our prisons. I know we have one in, I think it's Decatur. We have one Metro Reentry. We have a forensic there. We have one in, where is she at? Lori is in, God, I can't even remember, but we're putting forensics in the prisons, not just the daily reporting centers, but like she said, being in the prison and not having that support, And it's a beautiful thing because one of our, I think her name is Lori, she works in the prison, and a lot of the peers there, like they'll tell you if you ever meet them, like, hey, this woman right here, she came in, she shared a lived experience, but not just that. Like I said, what we do is we help them before they even get out. They already have a lot of this stuff established. Imagine getting out of prison and not having anywhere to go. We do that. So before you get out, we try to make sure, along with your counselor, that there's somewhere for you to go. Because, family members don't always say, yeah, you can come back here. And so a lot of people get out of prisons and don't have anywhere to go. We collaborate with the counselors there and start looking for places, whether it's a recovery center or whether it's using DBHDD and the housing voucher to establish them somewhere to go when they get out. So having forensics in the prisons now is huge. It's really huge.
Yes, it is. Thank you so very much.
That's wonderful. What really, I think what got me started on this, outreach has always been my passion. But what got me really interested in doing the peer support, I wrote a book, and somebody from prison, a guy from prison, he found me on Facebook. The book wasn't highly publicized or anything. He said that he was asleep, and he said God told him to contact me.
Amen.
He had somebody to buy my book and send him my book, and he was like, he needed the support. He needed the support on the outside, and God led him to me. I don't, I just know what he told me, and since then I've traveled. I've traveled different states, but everywhere I go, the Lord he sends me into places. It's not in the four walls of the church. It's working with the people on the outside, people that have been in prison, people coming out of county jail systems, people coming out of drug rehabs. I myself went to rehab, but it was more like a mental thing, trying to save my sanity. And I met a lot of people, and God was able to use me in those circumstances. So now, I dedicate my life to giving back to others, and I just want to be able to help the people in my community, because some people are not going to ask for help.
Amen.
And then, like in Atlanta, what I realized, because I used to live in Gateway. I lived in Gateway for about 9 months. That's where I started ministry in Gateway. And I realized a lot of people will talk to you, but they're not going to ask for help. And if you don't know their resources, I'm glad for these calls. I found I had got the email. The email showed up in my inbox, and I was like, okay. I clicked the link. I signed up. I was like, this is interesting. I'm going to see what God is doing here. I didn't get that email by mistake. God is doing something. He's doing something.
That's right.
It is where it's going to lead, but I just know that I'm here for a long time. And I thank you guys for sharing the information with me.
Well, thank you so very much for the work that you're doing and your desire to want to help folks, and for doing your part, because it takes nothing to be kind to other folks and to pass it on. So I thank you for that. And thank you so much for your testimony. And thank you so much, Ms. Jarrells, for coming on to give us information about Georgia Mental Health Consumer Network, the Wellness Center that y'all have in several places, the requirements and eligibilities, as well as your trainings. We'll make sure we share this information, and I'll get this out to you all before close of business today and have it posted on our YouTube page. And we'll make sure we'll be sharing it with individuals as well. So if there's nothing else, thank you all so very much.
Thank you.
Have a great day.
Thank you.
You too. Bye-bye.